Good afternoon and welcome to today's webinar, Staying Alive, Understanding Suicide and How the Pandemic Has Affected Suicide Risks. Thank you for taking time out and being here today. I am Ting, Senior Analyst at Penang Institute, and I'll be moderating today's session. As an urban anthropologist, I have always been curious in the workings of the human mind and how it affects society. Suicide is a public health issue that reveals the level of desperation experienced by individuals in society. In Malaysia, 468 suicides were reported in the first 5 months of 2021. That is an average of 3 suicide cases a day. This alarming number may not even reflect the actual number of cases due to poor data availability and underreporting, given the sensitivity of suicide. Suicide is a public health issue which affects families, communities, and entire countries and has long-lasting effects on the people left behind. Suicide cases surged globally in the midst of the COVID-19 pandemic. This webinar discusses the conditions surrounding these tragedies and the stigma surrounding suicides and mental health issues. We'll be running a live question and answer session at the end of the webinar, but you may also post your questions or comments throughout the session. You may type your questions or comments on the right-hand side of your screen, or if you would like to remain anonymous, you may post your questions by going to www.mentimeter.com and key in the required PIN number, which will continuously flash at the bottom of our screen. And if you miss anything, don't worry. This session is being recorded and will be available on Penang Institute's Facebook page and YouTube channel. I have with me today a good friend of mine, Dr. Lavanya Vijayakumar, who is a psychiatrist practicing in Penang General Hospital. She completed her medical degree at Malacca Manipal Medical College and obtained her postgraduate certification, MRCP Psych, which is Member of the Royal College of Psychiatrists, awarded to doctors who have completed the prescribed training requirements and membership examinations mandated by the Royal College of Psychiatrists, United Kingdom. She has experience with treating a myriad of psychiatric disorders, besides being a strong advocate of mental health. Thank you, Lavanya, for being with us today. I will now leave it in your good hands to tell us more about today's topic.
All right. Thank you so much, Missy. Thanks for inviting me, and thank you, Penang Institute, for having me over today. Let me share my slides first. Okay, Nitin, can you see my slides?
It's coming up. Yes, it's with us now.
Yeah. Okay, so I'm Dr. Lavanya Vijayakumar. I'm a psychiatrist currently practicing at Hospital Pulau Pinang. So without further ado, let me start on our presentation. Okay, so the main objective of this talk today is to spread awareness regarding suicide and have safe conversations so that we can come together as a society to prevent suicide. So, disclaimer, this talk is for educational and informational purposes only. It should not be construed as medical advice, nor should it be used for diagnostic or treatment purposes. And if you feel you're experiencing any medical condition, you should seek help from a doctor or other professional healthcare provider. This is a safety note. Talking about suicide might cause distress even when it's done safely. So let's all be mindful of how we share our ideas and experiences as it may impact others. Please feel free at any time to take some time off this presentation. And if you need, please talk to a professional. All right, I just would like to share, I'll put this again at the end of my presentation. These are some counseling care line services in Penang. This is the updated one from last year. So it's been very helpful to many people, and I hope we can share this around. Okay, so When we talk about suicide, this is the latest definition from an international study of definitions of English language term. Suicide actually means an act resulting in death, which is initiated and carried out by an individual to the end of the action with the knowledge of potentially fatal result and in which intent may or may not be there. All right. Some other terminologies which I'll be using would be suicide attempt is an act in which a person harms himself or herself with the intention to die and survives. Self-harm is a non-fatal act in which a person harms himself or herself intentionally with varying motives, including the wish to die. So this is from the International Association of Suicide Prevention. Over 800,000 people die by suicide annually, representing one person every 40 seconds. And that's actually very alarming. But this is only the reported number. What more for all the underreported cases that we have? All right. It is the 15th leading cause of death globally, accounting for about 1.4% of all deaths. And the global suicide rate is 11.4 per 100,000 population. And it's higher in males compared to females. It's the leading cause of death in people aged 15 to 24, young adult age group. And globally, among this age group, it's higher in males as well. Whereas for self-harm, it largely occurs among older adolescents, and globally, it's the second leading cause of death for older adolescent girls. In 2012, 76% of global suicide occurred in low and middle income countries, and sadly, 39% comes from Southeast Asia region itself. And in 25 countries, suicide is still criminalized, including Malaysia. So it's under the Penal Code Section 309, whereby if one attempts suicide, the person who survives will be charged, all right? And the sentence could be up to 1 year imprisonment or a fine, or it could be both. So just imagine when someone has already gone through so much of distress that they have decided to end their life, and after being a survivor, they need to go through litigation, they need to go to court, and they may be charged. So this is why we are fighting for decriminalization of suicide, and many of us are advocating for it, and a lot of work is going on for that as well. In an additional 20 countries, suicide attempters may be punished with jail sentences according to the Sharia law as well. Suicide is not caused by one factor. There's a convergence of risk factors, which we will talk a bit later, but it's not limited to genetic, psychological, social, and cultural risk factors, can be combined with experiences of trauma and loss as well. When we look into the mental illnesses, depression is the most common psychiatric disorder in people who die by suicide. 50% of individuals in high-income countries who die by suicide have major depressive disorder at the time of death. And for every one suicide, 25 people make a suicide attempt, right? When a person dies by suicide, 135 people are affected by each suicide. This is the network of people they engage with, which could be their family, their friends, their neighbors, their acquaintances, or even friends of friends who have heard about this, and it's detrimental. This equates to about 108 million people bereaved by suicide worldwide every year. Relatives and close friends of people who die by suicide are a high-risk group for suicide due to psychological trauma of suicide loss, potential shared familial and environmental risk, suicide contagion, which we will talk about later, and also the burden of stigma associated with the loss. So this is from the WHO 2019 statistics. 703,000 die by suicide annually. 58% suicide occurs before the age of 50. However, even in the elderly, there have been quite high rates of suicide, and men have 2 times suicide rate compared to women. Normally, the attempting suicide is higher in women, but the completed suicide is more in men because of the means they use, which are more lethal normally. Okay, so to put it in perspective, 1 in 100 deaths is due to suicide. It's the 4th leading cause of death in the young adult group, and 77% of suicide occurs in the lower middle income countries. 88% of adolescent suicides were in lower middle income countries as well. Suicides have complex causation. We will talk about it later. Suicides can occur in absence of mental illness. This is very important. It does not mean that everyone who attempts suicide have a mental illness. You could be someone without any mental illness, but suicide can still occur due to other factors and stressors. Suicide rates are high within vulnerable groups who are subjected to discrimination, including refugees, migrants, prisoners, indigenous people, and individuals from the LGBTI community. And adolescents are more affected by media portrayals of suicide. But all this being said, suicide does not discriminate in the sense that it can happen to anyone and everyone from all walks of life, right? Suicides have complex causation and they are very hard to predict, but definitely can be prevented. And it's everybody's business to prevent suicide. So when we talk about the multifactorial causations, you can see that this is just a model where in health systems, sometimes there's barrier to accessing healthcare. Maybe the time needed to see a psychiatrist or even going to the family medicine specialist or the clinic, there are a lot of barriers there. As per society, the access to means of committing suicide, inappropriate media reporting, stigma associated with help-seeking behavior. As for community, it could be disaster, war, and conflict, stresses of acculturation and displacement, discrimination, trauma or abuse. As for relationships, those with a sense of isolation, lack of social support, and relationship conflict, discord, or loss could be a factor. For individual factors, previous suicide attempt, mental disorders, harmful use of alcohol or other substances, family history of suicide, chronic pain and illness, also genetic and biological factors. And do notice that the COVID-19 pandemic runs throughout all these factors, all right? It can be a contributing factor in each level of this multifactorial causation. So this was a prediction in 2019 which came true based on a study. The mental health effects of the coronavirus disease 2019 pandemic might be profound and there are suggestions that suicide rates will rise, although this is not inevitable. Suicide is likely to become a more pressing concern as the pandemic spreads and has longer term effects on the general population, the economy, and the vulnerable groups. So this was in Japan. Initially, from February to June 2020, the rates reduced, it was less than 14%. So it was attributed to generous government subsidies, reduced working hours, and school closures. However, after July, it went up to more than 60%, higher in the female group, that more than 37%, and more than 49% in young people. This is another study that was done among healthcare workers in Malaysia. So, depression and suicidal ideation in a sample of Malaysian healthcare workers. Here, they did this study on about 171 people, and they found clinical depression was there in 9.9%, suicidal ideation 11%, and 53% of those with suicidal ideation did not meet criteria for clinical depression, thus explaining that you do not need to have any mental illness to have suicidal thoughts. Moderate to severe depression was strongest independent variable associated with current suicidal ideations, and a service duration of more than 10 years associated with significantly less suicidal ideation may be due to experience and all. But this slide just comes back to tell us that even those who are in healthcare system, although we have training in mental health services and all, it does not leave anybody. Anyone at any point of time can go through this. So the stigma associated with it has to be broken. When we need help, there are many people around to help us, and this is the aim of this talk today, for us to be more vocal, more open, and for us to be able to reach out when necessary. Okay, suicide, this is based on a study. There was increase in suicide ideation 10.81%, suicide attempts 4.68%, and self-harm 9.63% during the COVID-19 pandemic versus pre-pandemic studies. And the at-risk groups who have been disproportionately affected are women, young people, those with pre-existing mental health conditions, those whose employment status changed, and those from lower socioeconomic backgrounds. As we know, it has been a very difficult time for a lot of us. Some people staying at home has caused initially it was okay, but for those who, for example, there's a marital discord, they can't get along each other. Then when you put them together for too long without any space, it became worse, more detrimental. So even the domestic abuse rates went up during this COVID pandemic, and the calls to all these healthcare lines has increased by more than threefold. There has been a lot of social issues going on as well. Let's debunk some suicide myths. All these are false. Those who talk about suicide are not at risk of suicide. That is false. all suicidal people are depressed or mentally ill? No, as we already mentioned just now, that not everyone has a mental illness when they are suicidal. Suicide occurs without warning. Most of the time, there is some sort of warning, but it's maybe missed out by us, right? Asking about suicide plants the idea in someone's head. So many a times when we have a patient with their family, so as a clinician, when we ask the patient, like, have you been thinking of ending your life? When you ask this kind of questions, the family gets very worried, or they feel that it may plant the idea like, doctor jangan bagi dia this thought, don't give this person this thought. But in reality, asking about it actually helps because it's so taboo, it's so stigmatized that they don't talk about it to anyone else. When you talk about it and let them open up, it helps in many ways. So it is something that we actually ask regularly in our practice. Suicidal people clearly want to die. This is really false. It's a very dynamic state of mind. At that point of time, they're overwhelmed. They really struggle and they feel there's no way out. But when you talk to survivors or when you watch videos of survivors, they all want to live, and they all would say that the moment they tried or they attempted, they already felt a sense of regret and they wanted to reverse the action. But when you're so depressed, sometimes everything can look gloomy. So for example, if a person is clinically depressed, and some of them will even feel like when they attempt and it doesn't work out, that itself is a failure, and they continue to want to do it. So that's why it's very important for us to treat the mental illness per se. All right. When someone becomes suicidal, they will always remain suicidal. That's not true. As I said, it's a dynamic state of mind, and suicide is inherited. Suicidal behavior is motivated by attention seeking. This is a very false statement, but it's always something that is misunderstood, and it's a blaming kind of attitude by people. So when a person has actually harmed themselves, but when we feel it's because of attention seeking behavior, we may not take it seriously, and that can lead to a lot of effects. Yeah. Suicide is caused by a single factor. That's false. Suicide cannot be prevented. False again. Only people of a particular social class die by suicide. That is untrue. Improvement in emotional state means lessen suicidal risk. Not true exactly. So normally if you see someone who's been unwell for long, suddenly the person appears a bit happy, starts doing things excessively a bit more, we get a bit worried because we are worried that they are preparing to leave for good. So we have to take into context that as well. Thinking about suicide is rare, and people who attempt suicide by a low lethality means are not serious about killing themselves. So all these are false, yeah? The next question does self-harm equal is self-harm equal to suicidal attempt? All right. So self-harm is a non-fatal act which a person harms themselves irrespective of the apparent purpose to the act, including the intent to die. In one study, individuals who had self-harm were 49 times at risk of dying by suicide, and the risk increased with age. So if you look at this iceberg model here, suicide is at the top, the red color here, is the pinnacle of the whole thing. Self-harm that comes to our attention is only this small triangular area here, whereas self-harm in the community not presenting will be here. Many a times we get patients whereby it's normally emotional distress, say for example, a severe marital discord or a breakup. The person is so stressed up. We call it acute stress reaction, where they don't know what to do. At the point of time, they don't intend to die, but at the same time, they're so lost, so overwhelmed that they might actually harm themselves. Right? That's what we mean by self-harm. But sometimes the act itself may end up being fatal. So that's why it's quite dangerous. The impact of suicide. So when we talk about making sense after a suicide, each suicide affects about 135 people and leaves behind the bereaved. The second thing is grief, contagion, and clusters. Contagion and clusters will be all these 135 people who are left behind. They are at higher risk for suicide itself or for suicidal behavior, and then about copycat suicides, which may happen as well. So suicide robs communities of their most valuable resources, which are its people. Those who are affected, these are different levels you can see. Those who are initially exposed could be everyone who has any connection to the disease or to the death itself, including witnesses. This would include first responders, discoverer of the decedent, family members, therapists, close friends, healthcare workers, community members, school communities, workplace acquaintances, fans of celebrities, community groups, rural and close-knit communities. The second level will be those for whom the exposure causes a reaction, which may be mild, moderate, or severe, self-limiting, or ongoing. First responders, discoverer of the decedent, family members, therapists, close friends, classmates, co-workers, team members, and neighbors. Or it could be people who have an attachment bond with the deceased and gradually adapt to the loss over time. Family members, therapists, friends, and close working colleagues. And the long-term bereaved would be those for whom grieving becomes a protracted struggle that includes diminished functioning in important aspects of life. Mainly would be family members, close friends, and therapists. So we ask this question, does the media play a role? Media here can be the mainstream media, social media as well. So there is established causal link for media portrayals of suicide and suicide contagion, where there are copycat suicides or imitative suicides. This happens normally when the suicidal act is detailed, when there's explicit and detailed method and location mentioned, when they point it out to a single causality, prominent and repeated reporting where it's in a way sensationalized, like every headline is there, every day for maybe for a month it goes on, there's so many news about that. Celebrity suicides, when there are graphic images, when there are inaccurate personal information and myths, sensationalism, and glorifying suicide as a solution. So you just imagine a family who has lost their loved one. They're already dealing with loss. On top of that, dealing with media who's reporting all false information about their loved one or giving all kind of speculations, and then they glorify the suicide because most of the time we don't know what actually happened, but it's reported very very wrongly, all right, and it's just all speculations about this particular person who we don't even know. So it's terrible for the family and the friends who are going through this. When we talk about the suicide contagion or imitative or copycat suicides, with social media, it reaches a lot more people. So it could be geographical proximity, people living in the same area who may get affected. Social proximity, those who are socially connected to the victim, for example, maybe a friend, a cousin, a schoolmate, neighbors. This is someone who knows that person who has suicided. Or psychological proximity. Psychological proximity would be someone who identifies with the victim. For example, if it's reported as the victim was maybe a victim of bully or had a breakup. So then other people who may be going through the same thing would identify with this victim and may think that this is the answer. Suicide is the answer. And then we see a lot of imitative or copycat suicides. This happens normally in young people. So this is why social media plays a very important role. And this is where we can intervene. So the question comes, so why you report? Why talk about it if we think it's taboo? The main aim to report, why media should talk about it, is to prevent suicides. Because it is news, it's going to help people to understand more about suicide. We need to break down taboos about suicide, and they have a duty to report what happens in the communities, but it has to be done responsibly. So that's what we are advocating for. This is how media memainkan peranan penting dalam pencegahan bunuh diri. Alright, some tips on how it affects others. I'm not a journalist, so why should I bother? So now the problem is with the smartphone, social media. It's so easy to viral a message or a video to forward it. It's just without thinking, a person just clicks. It's at your fingertips to do it. So with poly-mediated age, media communication as both product and process, anybody can contribute and act as a producer, consumer, audience, and critic, and it's very dynamic. So we don't really know how the news of a suicide starts and spreads. We cannot trace the source, the information coming from different directions and social media platforms, and the diversity of emotions and views is sometimes many people don't think before they say things or type out a comment on social media. So it really affects whoever involved and also others in the similar mind construct. Ensuing communication between users and spread of news, it disturbed hierarchy of grief and there's bandwagoners around as well. And how those exposed in this mass dialogue are impacted, it could be a gift when there's mutual support, people coming up to help and support this family, versus a curse when there's unsafe messaging, intrusive, losing voice in a drone, different versions of the deceased coming up. Almost all communicate online regarding suicide with the intention that it is warranted. I mean, people don't think that it's not warranted. The reason they post something online is maybe they think that it's okay to post or they want to share something. But you must remember, when you communicate, you want to foster social connectedness and support. Grief, remember the person who has passed, and encourage help-seeking behavior. And our main aim is prevention of suicide. But some unintended side effects when you post about it is that it's a far-reaching numbers on social media. Suicide is then seen as an outcome that is inadvertently encouraged, especially in vulnerable people. Like I said just now, imagine they're going through similar stresses and they feel like maybe this is the best decision. So they tend to identify and want to follow what has happened. They might identify with the disease, so oversimplified messages about why someone died also may not help. These are some common do's and don'ts for safe messaging. This is from Canada, so the Public Health Agency of Canada. So the safe messaging things that are good to do will be communicates that suicide is a public health and safety issue like what we're doing today, explains that suicide is a complex issue that can affect anyone and takes advantage of opportunities to inform people while focusing on prevention, addresses a balance of protective and risk factors associated with suicide, and balances the use of statistics on suicide with enough context about the issue, uses credible sources and accurate statistics about suicide. So, what is problematic messaging? It's problematic when it communicates about suicide in a way that sensationalizes or stereotypes suicides and the people impacted. I did not share any articles because we don't want to spread the wrong message, but normally that's how it used to be. There will be pictures, the headlines itself will be very captivating, it can be very insensitive. When it magnifies or minimizes the cost of responses to suicide, suggests suicide is inevitable or not preventable, links suicide only with certain populations, when it lists risk factors, which is resembling a checklist without acknowledging or including broader factors, including factors that protects against suicide, focuses on statistics without adequate context or resources, and also uses jargon or technical, outdated, or stigmatizing language. Like, for example, we shouldn't say committed suicide because it's like a crime, right? So normally the term will be like suicided. So there are a few terms that has been used in the past, which is actually stigmatizing language. Specific online behavior that could be unsafe. Liking, sharing, retweeting, quoting or sharing a suicide note, clickbait, sharing, posting and adding links on pro-suicide sites, sharing posts from deceased social media platform, which is done quite frequently actually. You wouldn't even know the person, but then they would have found who is this person, they would have found the whole history of this person, the Facebook page, their Instagram account, send photos around. It's very sad to the person and also to his whole family and friends who are going through so much of grief. And there's no privacy at all in this. So the one thing we can do is delete and stop forwarding these kind of messages. Even in good intentions, increasing traffic in unsafe posts by reacting, commenting, and sharing is unsafe. Yeah. Communicating about someone you know who is affected by suicidal behavior. Do not post something about someone that you will not do in real life. Respect privacy and ask for permission before sharing. Be aware of grieving relatives and people. Provide accurate information only if you have it. And if it's celebrity suicide, mainly it should be safe messaging. Do not speculate causes. Be mindful of the volume and contagion. We talk about celebrity suicides. The risk of suicide increased by 13% in the period after the media reported the death of celebrity by suicide. And when the suicide method used by the celebrity was reported, there was an associated 30% increase in deaths by the same method. And this doesn't just happen in the Western world, it also happens in the Asian countries, whereby, because there's a lot of hero worship. When they will look up to a certain character, and when that particular person, the celebrity, dies by suicide, there is a high tendency for people to follow. So these are what we call as copycat suicides. The other thing is that nowadays there's a lot of online like theatrical sites where there are no censorship. So there are many shows that have come out where they depict the act of suicide, and the intention of the producer mainly was actually to help with suicide prevention. However, the initial scene itself depicted a very vivid scene on the person ending her life. So within the first few months itself, they saw that there was a rise in the number of suicides among the young age group. So much so they actually removed that whole scene, and then they put on helplines in this media in the particular show itself. The other thing is that sometimes when you watch these kind of shows, and if you identify with the character, that you feel like what you're going through is similar to the character, then the tendency that you feel that, oh, maybe by what she did, she got closure, or she managed to take revenge. So those kind of mind set comes in, and we've had even patients who come and tell me that they watch this show and they think that it's a good idea that they would like to follow. So it's very important for us, especially when you have young children or young adults with us, to be mindful of what they're watching and to always be able to communicate with them. Yeah. Responding to someone who may be suicidal. Okay. This one, you may be someone who tells you in person, or you may see a post online of your friend. Okay. Whenever you see something that is a bit worrisome, please take it seriously. Know your limits. Don't promise things that you can't do. Self care. Ask in private, acknowledge emotions and distress. Consider the safety. Get help if needed. And if it's unsafe, post report it. Arrange for help. Keep in touch with the person. Provide information. If at risk, you escalate. Call the emergency services. You can either call here, we can call the police, or you can call the ambulance as well. And if the person is refusing for help, you follow up with the person. If report unsafe, post. For those who are at risk, again, escalate for help, like emergency services again. So never take it lightly. Uh, every threat should be taken seriously. All right. So what are the clues that a person could be thinking about suicide? There are some indirect verbal clues. For example, I'm tired of life. I just can't go on anymore. My family would be better off without me. I have had patients telling this to me where they say that, doctor, if today I'm not around, I don't even think anyone would notice. So it just means that this person feels that not even one person seems to value her life. This is where it's very important for us to keep connected or keep in touch with our family, our friends. It makes a lot of difference when you just ask somebody like, are you okay? Why do you look different today? Is there anything I can do for you? It's just a simple gesture that we ask for, and that really makes a difference to all these people. Who cares if I'm dead away anyway? I just want out. I won't be around much longer. Pretty soon you won't have to worry about me. These are the type of indirect verbal clues that a person might, suggest. Whereas direct verbal clues would be directly telling you, I've decided to kill myself. I wish I were dead. If such and such doesn't happen, I'll kill myself. So these are direct verbal clues, and all these are to be taken seriously. Warning signs indicate a more immediate dynamic risk of suicide for the individual. Majority of suicides, 70%, have been preceded by warning signs. First, we'll be talking about suicide, seeking out lethal means, preoccupation with death, hopelessness, self-hatred, worthlessness, shame, getting affairs in orders, for example, writing a will, giving away your loved things, writing a note, saying goodbye, and withdrawing from others. So what we can do. Yeah. So the main theme from before was working together to prevent suicide. It's not something that can be done by one person or one man. It's as a community what we can do. So since the 2014 WHO Global Report Preventing Suicide, progress in suicide prevention is ongoing, particularly in countries where no suicide initiatives were active. Many countries have initiated their second national suicide prevention program, including Scotland, England, Ireland, and United States. So for World Suicide Prevention Day, September 10, 2020, The message was to take a minute every day to reach out to someone. It could be a complete stranger, a close family member or friend, because this can change a life. So, what is the importance of a community? So, we are all part of a community linked to family, friends, work colleagues, neighbors, or teams. Sometimes we become very isolated and disconnected from our communities, especially this time during the COVID pandemic. We have been all very disjointed, disconnected. But of course, some places families were back together. Some of us didn't get to see our families. So things like social media, video calls, and all help actually to keep connected. As a community, we have the responsibility to support and empower those who become vulnerable in our community. We are not Actually, as an Asian community, normally is better because we are more close-knit as compared to the Western community. Western community is more of privacy. People feel like you're being busybody if you come and get intrude. So, but sometimes now with the busy life that we have, we tend to forget that. So it's very important to be there to support each other. Reaching out to those in the community. So this is the new campaign that recently they spoke about, I think last month, but this was done much earlier, like in Australia and all, where they have this "Are you okay?" campaign. So if you're worried about someone in your community, reach out and ask them, "Are you okay?" Just a simple statement. It could be maybe, for example, you go to work, then you see this coworker who normally seems to be cheerful, but you see for the past few days, this person seems a bit down, a bit disheveled. So it's just a simple mean saying, "Hey, are you okay?" And that person, when he feels that nobody cares about him, you asking him, "Are you okay?" means a lot. All right. And by simply checking in with them and offering non-judgmental support, this is important, non-judgmental support, you can make a difference. Sometimes when someone shares with us, "I'm feeling down, I don't feel good," then don't say things like "you're overthinking everything, this is a sign of weakness." Don't say those kind of things. All they need to do, you need to do is just hear them out. All right, hear them out, give them your ear. Empowering our community. Encourage those in distress to tell their own story in their way and at their pace. By engaging in active listening and reaching out to those who are vulnerable in the community, together we can build resilient and strong communities. No one has all the answers. People are often reluctant to intervene when they are worried for others. They may not feel knowledgeable enough or may not feel like the right person. But it's important for us to know that when someone is in distress, they are not looking for advice. They just want to be listened to with compassion and empathy, like I said. And that is something that all of us can do. It's all in our power. And we learn from people who reach out. There are many people with lived experience of suicidal behavior or suicide bereavement, and they have a lot to teach us. By listening to this, it's often inspiring individuals. We are learning, and they may become empowered to seek help. So this is another way. Um, I did not share any videos because some of the videos are not safe, but there are many online. And having met survivors, it's very inspiring talking to them and seeing them because they have gone through so much. But now when you see where they are, they're living such a good life, and it's very motivational when you talk to them and you hear how they've gone through and how they've overcome all their challenges as well. So the main theme was we will be working together to prevent suicide, which that is what as a community we should do. So suicides can be prevented. The first thing is a suicidal crisis is transient and can occur in absence of mental illness. There are often warning signs preceding suicides, and someone expressing suicidal thoughts should be taken seriously. Talking about suicide does not give a person suicidal ideas. Okay, so I'd like to acknowledge my good friend, Dr. Ravi Varma, who has helped me. He is from the National Technical Working Group for Suicide Prevention and Suicide Prevention Research Malaysia, and he's done a lot of suicide work. So a lot of my sources of information is from him and Dr. Ng Yin Peng from Hospital Pantai as well. This is the counseling care line, which I think I'll pass on to Meeting as well later. It has been very helpful to many of our patients, and like you can see, there are many NGOs in Penang actually who are here to help. So please feel free to share this as well. Okay, with that, I thank you all.
Thank you, Lavanya, for such an insightful presentation. And
Meeting?
yep. I particularly found your points on problematic messaging um, interesting because sometimes, in this world where we live with so much social media and basically with the internet, we tend to, forward a lot of messages without actually thinking of
Yeah.
what it actually does to people who are directly affected by those
Yes.
messages.
Yes.
Yeah. So like, and particularly even you mentioned a point just now on copycat suicides and even for celebrity suicides, which becomes sensationalized actually,
Yes.
where we keep
Yes.
hearing news about celebrities so and so committed suicide. And um, while some people might think that, oh, what a silly thing to do when the person has got so much future ahead of them, we don't actually take, or at least, we don't actually really take a step back and think
Think.
about, think about why it happened and what
Yeah.
we can actually do to really help
Yeah.
people who are in that situation.
Yeah, and the danger with that would be it's not one two people who identify with celebrities, right? Especially a young adult group. It's a huge number of following, and when they feel like okay, my idol himself or herself chose this path, so they tend to want to follow that. Yeah. So that's why it's very important how the media portrays and reports it, and it's very important to have helplines and to show that there is a way that it can be helped, right? But this has been ongoing for very long, and that's why a lot of work has to be done. And the forwarding message, like the one take home message today that I hope everyone would remember, not just for suicide, any negative message. Sometimes you see it's a terrible accident, or it could be someone getting hurt. I mean, it's not something nice to share. It's a very it's a horrible event happening to someone, but maybe people don't think why are they even sharing it. Sometimes they just forward it, right? So if we could just take a moment, just delete it, and don't let it affect others. Yeah. And if you
Yeah,
could tell the person sending you, like, don't forward this, it's better not to, and all that, it will be good.
yeah. That's true because like there were so many times that I've received forwarded messages and pictures of
Yeah.
fatal accidents even,
Yes.
and then it goes viral like wildfire, and that
Yeah.
is one thing which is first of all it affects people who see those images
Yes.
negatively, and secondly it's quite irresponsible and also quite um, like it's not a respectful thing to do
Yes.
basically. Yeah,
And you're
you're
not
not.
you're not spreading any. I mean, by looking at it, you actually the person who sees it already feels a bit disturbed, right? So
Yes,
it's giving you a negative emotion. So why do we want to pass that around, isn't it? So why
exactly.
should we, right? Yeah, if we can stop it and end it there, this one stopping here will lead to a succession of people stopping, and then it stops being viral. Yeah, that's what we're talking about.
Yeah, and of course, it actually affects the people who were closest to the victims the worst,
Yes.
I would think, that we're not thinking about their loved ones
Yeah.
when we forward
And
those.
sometimes the speculations can be really bad. Like they would say, I mean, some people will say, oh, it's because of Along. They won't even know this person. Then they say, oh, it's because of a marital issue. And then
Precisely.
they speculate, they try to, they go and stalk their social media. They start sharing pictures of their loved ones, their family members. And then it's literally just speculation, and it's not easy. So that's why after a suicide happens, what we do normally is called postvention. So prevention is what we're talking about, right? Postvention is after suicide occurs. The things that we do normally is we reach out to the family per se, and the friends, also those doctors or healthcare workers treating the person. Yeah, and anyone in that network. So as much as possible for a long time, because the initial period is very important for the family who's grieving.
Yeah.
It's already a lot to lose someone, but going through all this with the media, like there was once I heard this survivor talking about she lost her loved one, her husband, and it was very bad because a lot of religious how to say, suicide is not something that is I mean, it is condoned by religion, right? Many religions don't want us to end our life by suicide. So they started saying very mean things that he would end up in hell, this kind of thing. So a person already lost her loved one, and on top of that, they used religion saying that this person will never be blessed and will end up in a bad place after that. So it's really bad already for her, and going through it took her a lot not to actually give in. But now she's doing very well, and she actually talks about it, and helps people. She started
Yeah.
actually, the good things that she started an NGO herself, and she's helping people who have families who have gone through this. Yeah.
Right.
So
Right.
it's something inspirational to see people who can take such a difficult thing in their life and they turn it to a positive thing and they're helping others. Yeah.
Yeah. I'm sure the whole overcoming period must have been particularly stressful for
It
her.
takes years. It's never fully gone, if you ask me, from what I see. But they learn to cope, and then they try to turn it into a positive way to help others. It gives some kind of fulfillment for some people.
Mm, yeah.
Yep.
So I just like to mention a little bit here to our viewers. I would like to invite interested viewers to post your comments or your questions in the comment section if you're watching from Facebook Live or our YouTube channel. Or if you would like to remain anonymous, you can go to www.menti.com and use the code which we have flashed here, 60433949. And you can post us questions or comments which we will address right away. And we have already received a few questions and comments from some of our viewers, which we will talk about in a minute.
All
So,
right.
to our viewers, stay on, don't leave. But of course, I'm not saying that you can't leave. Like Dr. Lavanya mentioned just now, feel free to leave if you need a breather. But we will start to address some of the questions now. So we have a question here, which says that coping skills actually do help us build up mental and emotional resilience in the face of challenges, right? But sometimes specific factors may precipitate intent to suicide and become too overwhelming. So, how can such a situation be avoided?
Okay, good question. First of all, coping skills is very important. So that is something as parents or those when we have younger kids or younger adults, it's something that is actually very lacking currently in the younger age group. So the patients that we see nowadays compared to before, when you see, they come in very young. Actually they come in as early as we have 7 years old, 8 years old children, and it might be small things to us, but to them it's a big thing, and they're not used to failure. They're maybe used to a very safe environment that they can't cope with small stress. So coping skills is something that takes us a far way. But that being said, despite how well our coping skills are, when there is a precipitating factor, for example, normally maybe a family issue or financial issue, unemployment, maybe you have a lot of loans to pay, it is a lot of stress, right? How to overcome it is, first of all, to be able to talk about it. What happens, especially why we see that, like for example, suicide is higher in men compared to women tend to talk out or speak out and ventilate what they feel either to their friend or some trusted one. But for men, normally they keep it within themselves. Not all men, but generally, or even in women it happens sometimes lah. So when you keep it within yourself, it builds up and it eats you up internally, and that eventually leads to mental illness, suicide, and all that. So the first thing is actually trying to talk about it to someone you trust. Okay, it could be a friend, it could be a counselor. Now that with all these online anonymous callers, you can actually call these people who are counselors, who where your identity is actually confidential, and you talk to them. Just letting it out itself is a good thing. All right. But to completely, stress is something we cannot avoid. Correct. This kind of situations is not predictable as well. So when it happens, if we can find for help, that is good. And other things that we can turn into is, like for example, those who have a religious background, who religion will be protective. Yeah, going back to that would be very helpful. Spirituality, and then trying to take some time off this problem. it's difficult to forever be positive and think, you cannot always be overly optimistic, but trying to have a positive mindset that no matter what, I will somehow rather come across, overcome this problem, and take some time to calm yourself down and think about what can be done and look for the means for help and reaching out for help. That is the most important thing, I would say. All right.
Right, right. So, just a follow-up question on that. So you mentioned that, yes, opening up and talking to people will definitely be helpful. But what if, like you mentioned just now that sometimes, men, they might not want to open up as easily as women. I mean, that's the general uh, perception of it. But what about, how do we help people who does not want to say anything at
Okay.
all?
All right. So first of all, if you notice a change in your friend or your loved one, that they have become more withdrawn, they are more isolated, you can see the changes, right? Okay. First thing you can do is, like I say, okay, are you okay? And try to talk to the person. So let's say, for example, you're a parent and you have a child or maybe a nephew or niece. It's a different age group. Say maybe the person doesn't want to communicate with you. Maybe try to get someone who the person maybe is close, who can open up to, maybe a teacher, or maybe a friend is a bit dangerous at that age, but maybe someone a bit elder, try to talk and see. And if we have cases where still no avail, we do ask them to pass this kind of context. So we say that it's okay, you don't have to tell me, but these people are professionals. They know how to help you. You talk to them. I don't have to know it, because you respect the privacy, especially the young adolescent age group. They really want their privacy respected, and it's an age where they might feel that we're being too intrusive towards them. So maybe, okay, passing these kind of numbers. And a lot of NGOs actually, like for example, D Home and all, they have a lot of programs in their center where it won't really focus to the problem itself, but they have maybe like some art therapy, or some other connectedness with other people who may share their experiences. And maybe when you bring this person there, listening to others, he or she may be able to open up. So these are some things that I can think of. Yeah. But if you really think it's getting out of hand, this person is really not talking, really getting out of hand, um, maybe if you don't want to see a psychiatrist, you can try to bring to your GP, your general practitioner, or the clinic kesihatan, family doctors, where there's less stigma. Sometimes the stigma is too much when it comes to when you say it's mental illness or anything, but sometimes actually it's sometimes just normal stress. They just need to talk to someone, right? Some of my patients, when they face this, I ask them to bring to the ustad or the pastor. Maybe they feel religiously inclined. So it depends on each and every individual how to go about it. School counselors is a good option as well for students. And if really no choice, if you think that it's getting really, really bad, if it's really severe, you see maybe suicidal intent is there and everything, the police actually can help to bring in the person for interview. But that's again forceful means lah. When there's no choice, when you really have to escalate, the police actually can help you to bring this person for him to be examined lah. But we try our best not to use forceful means. We want the person to voluntarily come to us. In other places like BM and all, we have something called mentari. Mentari is where they try to be out of hospital. So you can go and see the doctor out of hospital. You'll be maybe in another clinic. In Singapore and all, they have it in the shopping malls. So they don't stigmatize this person. They can just walk in anytime. Yeah. The other thing I would think about is maybe online teleconsultation. Maybe that's something we can think about as well. Yeah.
Yeah. And speaking about online, I was just thinking, with the prolonged pandemic, many of us are actually who have, I mean, because of the mitigation efforts actually for COVID-19, many people are actually stuck at home, basically, which I feel would have, encouraged more use of social media,
Mhm.
and, well, basically the internet to socialize online in lieu of our normal face-to-face interactions, right? Would you think that some issues of perhaps cyberbullying, may have, um, encu- you know, unfortunately encouraged more suicidal thoughts? Uh,
Mm,
you know,
like we said, suicide is multifactorial, right? That could just be one factor. Like the media, everything needs to be done in moderation. This is something that I always believe in. without the social media, you imagine you don't have WhatsApp and all that. You can't video call your family members who's far away. You don't see them for 1 2 years. So many people keep connected through social media, and many people do use it positively. But like you said as well, I think there are many people who are using it for wrong means as well, and too much time. Even for example, just take COVID, the news itself. Some of my patients, they come in, it's like everywhere. It's just COVID, it's deaths, negative news, relatives and friends, going off because of this. So much so that it is really so distressing. We've had many people come in who don't have any other problem, no other stresses. The main stress is COVID per se. It may not even happen to their own circle, but just this negative news, perpetually, where there was no improvement initially, is very terrible, right? So that itself can lead to a lot of stress. So then we advise you to take some time off social media, have a healthy, positive lifestyle, do exercise, try to maybe have off screen time, where you're just with the environment per se. You can practice things like mindfulness. When you just do some deep breathing exercises, maybe do some relaxing activities, some yoga, meditation, could be Qigong or Tai Chi, this kind of exercises. Online itself, they have a lot of teaching sessions, isn't it? And then you could do things like aromatherapy, which helps you to get some nice fragrances. Yeah, it's just relaxing activities and positive lifestyle that might help.
Right, right.
Mhm.
Also another point which I was just thinking how, like recently we've actually seen more news on children committing suicide, and that is a very alarming situation, I would say. Many of them, it could be because they're worried of letting their parents down due to exam results, which I think is really such a pity. But like, is there anything that we can do to help curb that situation?
Yeah, I mean, normally we used to see, right, after major exams last time, there will be some news. I think our whole mindset should change. It's not just about exams that actually measures a person's success, right? So, first of all, as a community, I think we need to change that mindset. People can excel in different fields of life, and it doesn't mean that everybody needs to score 100 to be perfect. So, that mindset as a parent. And apart from that, it's not just the exam part. Nowadays, there's a lot of bullying, a lot of body shaming, self identity issues. As a teenager, you feel very, what's the word? You may feel inadequate and you feel unsure of a lot of things. So, little things to the parent or to the elder person, you might feel like it's such a small thing, but to that teenager, it's such a big thing impacting him. So, the best thing to do is to be a friend, even as a teacher, to be a friend to this young person, so that he or she can open up to you and express how they feel. The main thing is when we can teach each other to open up and talk about our feelings. That's the most important thing. I always like to quote this movie, this cartoon called Inside Out. If you should watch, those who haven't watched it, it really it explains our emotions and how important it is for us to acknowledge our feelings and talk about it. Yeah.
Yeah. And I think like I would think that one of the reasons people dare not open up and even basically talk about all these things is basically, like you mentioned just now, the stigma behind
Yeah. Yeah.
suicide in our community. And like, especially like you mentioned just now, that most religions would make this whole idea of suicide to be a taboo thing, and that
Yeah.
the whole idea that if you commit suicide you're going straight to hell,
Yeah.
that sort of thing would actually make people not want to talk about it even
Correct.
more, even if they already have ideas
But that
about
being said,
it.
sometimes whoever says that, their intention is not to look down at the person or to they don't know what to say. Even
Yeah.
I've seen clinicians who do that, who will say that, do you know this is a crime? You can be charged by the police. So that's how it starts. Or because they want to say something to stop the person from doing it, but they don't know how to say it right. So they say this kind of things thinking that it'll prevent, but to that particular victim, it's going to be worse.
Mm.
It actually makes them feel even worse than they already do. Yeah.
Yeah, yeah.
Mm.
So like, yeah, you're right. Because we always hear of people saying that people who attempt suicide are like, well, for the lack of a
Weak.
better word, like, yeah,
Yeah.
weak,
They would say
and
cowards. Yeah, these kind of things should be not used.
precisely.
Yeah.
Yeah, and like you mentioned in your presentation just now, the double triple stigma which happens when, let's say, they attempt suicide and it fails, and then they still have to go through litigation because
Yeah.
they survived the the suicide, right? The suicide
Yeah.
attempt.
Yeah.
And that just makes a lot that just makes things so much worse when people around, or even those viral messages which goes around saying that, you're already weak and now you're even weaker, you can't even take your own life. That's sort of
Yeah. Yeah.
very bad sort of things. Okay, so we have a question here from a
Okay.
viewer. The person has been suffering severe depression for a year with therapies but not recovering. It is hard to cope with work, and the person has been prone to
Okay.
suicidal
Thoughts.
thoughts. So, what
Okay.
would you?
What I would advise, first of all, is I'm not sure whether you're on medication. So, depression definitely needs to be treated. Clinical depression, there are many factors causing it. So, biologically, medications definitely need to work. And when you talk about medications, there are many types of medications which may be suitable for one person, may not be suitable for the other. So, please see your doctor. I think they will step up the medications. Apart from that, therapy definitely helps. So, medication and therapy. And anytime if you don't feel good, you feel there are some suicidal thoughts, please go back either to the emergency department or go back to your doctor as soon as possible. Yeah, it's not something that we should leave. Yeah, and like I said, when you're depressed, everything looks dark and gloomy. But trust me, all my patients have said this, that it may take a long time, but once it gets better, you will see the other side. Yeah, please do seek help.
Yeah, yeah. Thank you so much for that, Lavanya. So I noticed in one of your slides that any signs that we receive from people who either verbally or in their action show signs that they are thinking about the idea, that we should take all of it seriously,
Yes.
right? Yeah. So I was just thinking, sometimes when we hear of people saying that they have suicidal thoughts, there might be a part of us who are thinking that, are they trying to get attention,
Mm.
or are they just is it just a threat so that people don't leave them? You see, so like you say, it's actually a suicide myth. When people think that suicides are motivated by attention seeking, which is
Yeah. Yeah.
not true. So
Yeah.
basically, any signs at all, whether verbal or physical, should be taken seriously,
Yes,
right?
definitely.
Yeah,
There
and
are there are other conditions, like there can be some personality disorders, which are like, for example, borderline personality disorders, where self-harm is very common. But even then, we would say that every attempt is a serious attempt. It has to be taken seriously as into why is the person going through that means. But it is a common misconception, that it is for attention seeking, especially in relationship issues. Many a times, yeah, the partner thinks that this person is trying to seek attention. And for example, when the person does that particular act and say the partner does not respond, then it becomes a more serious method of harming yourself, and eventually that itself can lead to the suicide or the end of life, you see. Yeah, that's why if you don't stop it initially, it will escalate.
right, yeah, and
Sorry, one more thing is, know your limitations. So like, once when I met a survivor, he said that his friends were there with him throughout the moment they knew he was having it. So it's very good if you could be with this person, if it's your friend or someone, to be with that person. So normally, if we are going to discharge a person who we think may have some thoughts, or have some risk of suicide, if the family can guarantee us that 24 hours they are going to be with this person there, and they are confident only, then we allow them home. Otherwise, we will definitely advise for admission to our unit. But that's why, so it's important to be with the person, but don't give false promises like, tomorrow itself you sleep, tomorrow your problem will be solved. Like, okay, this will, like, you don't give promises that you cannot keep up, or things that you cannot predict, don't promise. Yeah, so be realistic. Be realistic. So sometimes you say, yeah, I mean, it is very difficult what you're going through, I can't imagine also what I would do at that point. But I'm here with you right now. Let's talk about what we can do here. Those kind of things. All right.
Right. Right. Yeah. So, and yeah, we were also talking about how we might see verbal and physical cues, but there was also a myth which you mentioned, which I found that we should all be also aware of, which is that if the person does not actually display any de- like sad sort of facade or depressed sort of facade, but instead, the person might actually have a very happy outlook, we will never know what is going on in their minds.
Yeah.
So, like when it comes to cases like that, is there anything at all that we can do? I mean, okay, maybe apart from the fact that if we know that something has happened to the person, something bad has happened to the person, but the person still outwardly look fine and happy and
Yeah.
cheerful,
This
right?
one is normally with high functioning people, like we say high functioning depression, where they're so good at their work, they're so good at covering things up that you would not know. It's only the closer circle of them who may know. But let's just remember that anyone who is lonely, they feel disconnected, there's no one there. So if just generally being a friendly person and being there for someone, but if you can't see, sometimes you really cannot predict. So it's more like awareness for the person trying to spread these kind of messages. Maybe we should start by going to schools, educating children from young that this is something that can happen to any one of us, and there is treatment. Because if you talk about hypertension, diabetes, stroke, people rush to the hospital for help. But when it
Yeah,
comes to mental illness, the stigma is so heavy. It's always we are the last resort. Now it's a bit better. When I first started, they would go to temple, they will go to the mosque, they'll go to the bomo, they'll go to everywhere else, and then finally they come to us. But over the years, I think it has improved. I think the awareness is getting better. And but I still do have patients like, you want to go and see a psychiatrist, like, are you sure that's for mad people, or this kind of thing should not be there? So like, even if the person wants to come, there are many patients who don't tell their family, that they're seeing a psychiatrist or they're coming to the psychiatric unit. They feel that the parents will not be happy. Parents feel like they are, it's a sign of weakness. So this kind of stigma is still there, which we need to break. I also have healthcare professionals. It's even more difficult to treat healthcare professionals because of the stigma within. It can be even within our fraternity itself, where even the clinicians themselves feel like, it's a sign of weakness. So the awareness has to go through all levels of society, that this is something treatable. It's not something that you need to suffer with. It's not easy, but once you come for treatment, and early treatment always has better outcome. So the earlier you come, the better. Yeah.
right, right. Yeah, I agree that the stigma is still quite strong actually, despite all the awareness that has been going on. And like you mentioned just now, when a person goes to see a psychiatrist, right? There is a stigma that oh, the person is crazy, that's why you have mental health issues and all that. But the interesting thing which I found talking to you before this is that we can also seek help if we have issues such as simple as like insomnia, for
Yeah.
example.
Yeah.
Yeah. So which I found very interesting, because somehow growing up in this society, and maybe also because it has been sensationalized
Mm.
in the movies that we watch, right?
Yeah.
That if you go to a psychiatrist, that means there is something with you, something wrong with you mentally and all that. But
Yeah.
that should not be the
Yeah.
way that we think anymore.
Yeah.
Yeah. Yeah.
Many of them come just because of stress. It could be a change at workplace, or change, some difficult situation they are facing. Yeah, sleep problems is one. Memory problems. Some will just be there are so many different kind of conditions that we do see. And for children, I mean, there are of course things like autism, ADHD, that learning disability, and then behavioral problems. And for the older elderly, also we have our memory clinic. So we see everyone from every age group with multiple problems. Yeah. But it's a common misconception, which is slowly getting better. Yeah. And normally, no matter what we say, it's after they come to the services and see themselves that they gain the trust. And I mean, it's not just the general hospital. I mean, a lot of private psychiatrists, private clinical psychologists, counselors available as well. So anywhere that you feel comfortable, it's okay to seek help. Yeah.
Yeah. And speaking of like sensationalizing the suicide issues, even on TV series and movies, which you mentioned, I mean,
Mm,
you know that these things happen,
yeah.
even on TV series, which I wouldn't say that it encourages suicide, but like it might
Influence.
plant, yeah, the wrong idea
Mm. So
in
actually,
people.
this particular series, I had personal experience where I did not know about this series initially, and a patient of mine actually had come to see me, as a first time I'm seeing her, and I've heard about this series, but I've not watched it. So whatever she told me, it sounded very similar to what I have heard. So I actually watched the series to know, and you won't believe it. It's actually the story was exactly that. So she actually really identified with that victim, and she was planning to do the same. So this particular series, the protagonist would actually end her life, and she would give a number of people. She would send videos to a few people who contributed to the reason why she ended her life. So it was actually quite bad because many people that age group they found there was a rise in suicide after that. But more than that, it was how to say it was more like how this when I myself had this experience with my patient, I was quite alarmed as well that it really impacted her so badly, and she really considered doing the same. Yeah.
Right, right.
So it's very important what they portray. But after that, the particular show, what they did is they every episode they will put helplines, and the characters will actually talk about it and say that this is not the way we want you all to seek help and all that. So it actually helped. Yeah.
Yeah, yeah. I think
But last
this.
time we don't really think of all this, isn't it? We don't really think about it.
Right,
Like even if there's movies where, for example, in the movie, like in India, they did a study. So the movie, the hero, let's say, dies by suicide. That year, the suicide rate will go up. But say
oh
they
wow.
show that the hero seeks help, and they actually got better, and all that. Then it actually reflects on the society. So it's very important what is shown at the media level.
In the media, yeah,
Mm.
yeah. And I would say that this has actually been happening for years and years
Yeah,
before this.
yeah, yeah.
Not just during the internet era, but like even years in the olden days, right?
Yes,
Where people might actually embody the character of
correct.
the movie that
Yeah,
that they were watching and get truly affected by the
yes,
storyline itself. It's not
correct.
like they personally have stresses that they're going through, but because
Yeah,
they watch a particular movie, and especially if the character is portrayed by a celebrity that the person idolizes,
yeah, yeah,
they might actually embody the character in the storyline and get
yeah,
really
yeah.
affected by that. So,
Yeah. But
um,
now the problem is that the outreach is much more because of like all these online platforms. So
mm,
like now you see, it doesn't mean that a Korean film is only watched in Korea, right? It's watched all through the world with all this. So like it's more widespread the effects. That's why we have
right.
to be more mindful. Yeah.
Mm, mm. And so, like coming back to, since we are talking about media and how widespread it is, right? Um, would you think that because of this whole lockdown, apart from cyberbullying, right? There are also cyber crimes which are
Yeah.
happening, right?
Yeah.
Cyber crimes which involves monetary fraud, even emotional frauds, right?
Yes.
People get tricked emotionally, get cheated by people they don't know online. What would your advice be for
See,
people who?
all this stems from loneliness, right? I mean, like getting emotionally, it stems from loneliness. So building a support system around you is very important. But COVID has been a very difficult time for many of us. Some of us were lucky that maybe we stay near our nuclear family, we could see them, but many of them were far away. They can't see their friends. Some students, they are just back in hostel alone. They can't even see their batchmates. It is a very testing time. Thank God things are better now. So, like I said again, positive lifestyle. Try to stay connected at least via like WhatsApp or video calls, those kind of things with people that online. Getting to know people online has always been a dangerous. There is dangers. It doesn't mean it's always dangerous, but just be careful. If something seems to be too good, and it's normally something to take caution of lah. Yeah.
Yeah. What about, like I know you said that we can take steps such as maintaining a healthy
Healthy lifestyle.
lifestyle and keeping in touch with a good support system. But what about those who don't actually have the opportunity to do that? I've heard of cases whereby yes, they are living with their nuclear family and communication is good, but the thing is, because of staying at home too long, and it doesn't even have anything to do with social media. It's just the fact that we've been
Just
cooped
staying
up
at home.
at home,
Yeah.
and like
Yeah.
some people are also, if they have, let's say, comorbidities, they're just too afraid to leave the
Great to
house
come. Yeah.
anyway.
Yeah,
Um,
exercise is something very
oh,
important. Exercise, even in your home, you can do exercise, isn't it? So actually, that helps us with our happy hormones that are released, like we call. So that itself helps. So if you could have a exercise routine, that'll be good. Board games with your family members, that would be something nice as well to break the chain of boredom. Yeah. And then, like I mentioned just now, things like the aromatherapy, some relaxation breathing exercises, just deep breathing helps. Yeah. If you could go out for a walk without being too fearful, that would be good. Yeah, it depends on your area and how that would be. Yeah, that would be all I can think of. Storybooks, reading storybooks. Yeah, developing a hobby lah. Normally, a hobby that speaks to you. Could be reading, could be some form of art. I have patients, you won't believe, they're like much older, like say about 70 plus, and then we suggest things like coloring. So the kids will be like, she's not a child, why are you asking her to do coloring? But it makes the person feel she liked coloring. So they bought her a coloring book and she really enjoys it. She feels so distressed. Lack of stress when she does it, and she feels like she's doing something that really helps her. So something as simple as coloring, it doesn't have to be a beautiful painting or anything. Just letting the person scribble something itself is good. So try to find something that you can identify with and do. A simple hobby, that would be something good. Yeah. I had a
so
patient, she started doing pottery. Apparently, she bought some things and she started making some pottery. Some do some digital art painting. Have you seen? They have numbers that you can follow. Yeah,
yeah,
so a lot of artists were created, a lot of new hobbies. Some people started cooking. Those who don't know
yeah.
how to cook at all, they started cooking. So it's new living skills that they develop and learn, which is very good. Yeah,
Would you say that it
those are
is actually perhaps doing something which takes our mind away
yeah.
from thinking of the problems that we may be
Yes,
facing?
when you have too much time and no distraction, then your mind tends to overpower and overthink, isn't it?
As well.
Yeah,
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 yeah. So like too much things to think about is bad, and too little things to think about is also bad,
but
right?
yeah.
Yeah.
Moderation is key.
Moderation is key.
Yeah,
So best to, I mean, if so, basically, if there's anyone who would, who feel uncomfortable with whatever they're facing now, perhaps a hobby might help. A
yeah,
hobby which can take our minds away from our
away.
issues
And
at
another
the home.
thing that I would normally tell is my patients as well is that when you're feeling a bit low, try not to watch things that are going to bring your spirits down, sad
Right.
movies, even horror movies and all. I ask them to watch comedy, read things which are, uplifting your spirit. So try to surround yourself with more positive things. Or even another advice that is sometimes you're already feeling down, and say someone else calls you to pour out their problems, there must be a limit because you yourself are not okay. So you must know your limitation. So maybe you must tell the person that I'm so sorry, this is not a good day for me, that I will get back to you later. I myself need some time. So because some of the people that I see, actually, they don't have a problem in their life, but maybe too much of being the shoulder to too many people eventually ate up, and they did not, speak out or talk about it. So you must know your limit and your limitation, and always self-love is very important. I'm not asking you to be selfish, but always remember to put yourself and love yourself first.
Right, right. Yes, yes. I've heard of many cases whereby because they are known to be good listeners, friends and relatives tend to, confide in them, and that might actually bring a lot of extra stress, I would
Yeah,
say, extra
yeah,
stress from listening to other people's troubles,
problems, yeah,
right? So yes, thank you so much for that great advice. That it is not wrong to tell people that maybe we should take a break, and
yeah,
I don't think this is a good time for me to listen
yeah.
to this. And so it's not a bad thing to say no,
Yeah, you don't have to
basically.
feel guilty to say no. I think that is something in the Asian culture that we don't
Yes,
say, right? We feel very bad to say that. But if you don't
yeah.
know where to stop, then you are eating yourself up in the process. That's not good. Yeah.
Hmm, hmm. And also that if there is any issues at all, that it would be great to open up to friends and peers,
Yeah.
family,
The other
to
thing I would
basically,
like to reiterate is that, we are very worried about how the society or people will judge us when we say something. So I think we need to change our mindset that everyone lives their own life, right? And people will always have something to say about certain things. But if you're true to yourself and you know what you're doing is right for you, just go ahead and do it. And it's not wrong to share how you feel or, look for help.
so don't worry about being judged by other
Yeah.
people,
Yes.
basically. Yeah,
Yes.
yeah, because we all need to live our lives.
Correct.
Yeah, right. So thank you so much, Lavanya, for this most interesting talk. Very insightful. I learned a lot. To our viewers who may have missed our conversation, don't worry. This session has been and is still being recorded, so you can view it on Penang Institute's Facebook page or our YouTube channel as well. So thank you so much. I would say that wraps up our discussion today. Staying alive, understanding suicide, and how the pandemic has affected suicide risks. Thank you so much once again, Lavanya, Dr.
Thank
Lavanya
you.
Vijaya Kumar, for being with
Meeting
us.
and I are school friends for many, many years. She's one of my best friends. So it's been
That's
nice
right.
having a session with you, Meeting. Yeah.
You're most welcome, and we're
Thanks for
so
having me.
I'm so happy to have you with me as well. Yeah,
Same here.
thank you so
All
much.
right.
Take care and stay safe, everyone.
Okay. Bye bye.
Bye.